Hi, welcome back to Rohrich Knose podcast. I'm Dr. Rod Rohrich from Dallas, Texas, and helping you become a better you. And I have an amazing, fantastic dermatologist here from New Orleans, I mean, a very good friend of mine, Dr. Mary Lupo. Mary, welcome. How are you doing?
Well, thank you, Rod, for the invitation, and I am doing very well.
Yep. And of course, you look amazing. You always look amazing. Now, Mary is an internationally known dermatologist. She's a clinical professor and is an incredible teacher at Tulane University in New Orleans. And she's one of the co-founders of Cosmetic Boot Camp, and I've been honored to be part of that faculty for a few years. And we have a lot of fun. And she's a phenomenal dermatologist. So whenever I have a complex problem with dermatology, I often call Mary. So Mary, let's talk today about a couple of things. I think, you're very good at talking to your patients about things they need and don't need. So, what about when, like, the three things that you tell them or procedures, like they're coming in, they're maybe early 40s, and they just say, hey, Mary, tell me what would make me look the best? What are the best things that would help me look good? And they trust you. I mean, that's a great thing. I mean, you're very honest, and that's what I like about you. You're not a BSer, and we don't like BSers. So what do you tell a patient like that?
Well, I often use myself as an example. I, as you know, am right behind you in age, and I've not done plastic surgery. I haven't had a facelift. Everything that I've done has been with injectables and devices. Yeah. So, and I started Botox on myself almost 30 years ago.
Really?
About 1996 was the first time I injected myself with Botox. I was my first patient for Botox. I was patient zero.
Yeah.
And I wanted to make sure that it did what my colleagues who were using it. I actually know the Carruthers, right, who really discovered, if you will, the use of botulinum toxin in a cosmetic fashion. And the Carruthers are a wonderful team of an ophthalmologist and a dermatologist. And They noticed that when people were getting treated for blepharospasm and other ocular conditions, that their crow's feet got better. So they tested it in the glabella area on their receptionist and said, whoa, look, it makes it look better. So knowing that very early on, before it was even FDA approved, I was using it, as many of us were, what's called off-label.
Right.
Off-label is when something is FDA approved for one thing by the FDA for the company, but we as physicians, the FDA does not monitor or have an impact on the practice of medicine. Those are medical boards that do that. And so we are legally allowed to do things what are called off-label.
Right.
And as long as the product is legal in the United States. So I wanted to try it. So I injected myself the first time. I gave myself a little bit of a Spock. So I learned from that experience.
Tell us what a Spock is, Mary. Tell us what a Spock is. Remember, and these are people that are just very curious. So I like it when you say, I'm doing only things that I do myself. I like that. I think that's very important. You don't want to do things that you wouldn't do yourself. I mean, you're beautiful. So tell us what your Spock is. One of your eyelids was up. One of your eyebrows.
I don't do anything to myself that I wouldn't do to myself. Or if I don't need that particular thing, I wouldn't do it to a family member. Right. If I'm not going to do that, then I'm not going to do it to my patients. So a Spock is when you're treating the glabella area, which is the frown complex. You sometimes can, early on, we were injecting a little bit too high. And you would relax the medial frontalis, that's the forehead muscle. And when you relax one area with botulinum toxin, you get compensation or strengthening of an adjacent area, and it actually lifted there. It was easy to fix,
right.
And it taught me that I could use the botulinum toxins, back then it was just Botox, to actually shape people's eyebrows and give them a brow lift and reshape how their brow arced, if you will. And if people's eyebrows are too low in the middle and they look angry, you can raise that. And if they're too high in the middle, they look quizzical. And if they're too high in the middle, they look sad or concerned. So you can really make, especially a woman's brow, you can make the female brow look more feminine, less angry. Right. You can make it look less sad, all by the position of the eyebrow.
So, okay, I think that's great. And, you have to have somebody that is a master of that. And, you've obviously done it for many, many years, and so have I. And I think that's important. That's why, we don't want our patients, and our patients don't go to spas. But you really need to have somebody that understands the anatomy. I think that's very important. So that patient comes in and they say that. So you do a Botox, and I'm using Botox. It's like the word Kleenex. I mean, there are multiple different approved FDA neuromodulators: Dysport, Xeomin, Daxi, and of course Botox. But
Jeuveau.
And Jeuveau is awesome.
Which is my personal favorite.
Yeah, and Jeuveau, which is phenomenal, and they're all excellent. Every one of them is excellent.
They all work a little differently.
Yeah.
And I find that one product in some person's hands works a little bit better maybe than they can do exactly the same thing with a different product, and it might come out differently. And certainly some diffuse more and some are more precise, and there's a spectrum in the middle of those things. So it's not, I tell people all the time, it's not the filler, it is who is doing the fill.
Yep, that's right.
The big filler.
Yeah, it's
so the same thing is true with neuromodulators, and the importance of doing neuromodulation early. And 40 is actually a little late.
So why is it important? Do you believe in prejuvenation? Tell us about that.
Oh my
Prejuvenation.
God, absolutely.
You do. So I know your beautiful daughter has it.
Yes.
And so
she started I gave her injections starting when she was about 22.
22. And so tell the audience.
22.
Prejuvenation.
22.
Here's
right
Mary.
after she got out of college, she was in the working world, and what pre-wrinkle toxin does is it prevents the etched in line.
Right.
Because if you are constantly moving a muscle and there's a dynamic creasing of the skin because of that muscle movement, over time, and because of deterioration of the skin from sun damage and birthdays, that line is going to become etched in. Once it's etched in, it is much more difficult to get rid of. And you usually have to also add some sort of laser device in order to get rid of an etched line. Sometimes we use filler, depends on the location. But the three things that I tell my patients that I started very young are, the trinity of treatment, which is injectables, devices, and skincare.
Okay.
And under injectables would be filler, and under filler would be the dermal space-occupying gel fillers like hyaluronic acid and full-strength Radiesse. And on the other side of fillers is the biostimulatory fillers, which are my personal favorites. And biostimulatory fillers...
Tell us what that is.
...simply refers to fillers that don't occupy space, but stimulate your body's own immune system to produce new collagen because of the stimulation. So, and we do that at this time with both polyl-lactic acid, which is called Sculptra, and hyper-blended Radiesse. And all that means is you take the thick Radiesse and you thin it out so it becomes more of a liquid like the Sculptra is. And you use it not to fill a line per se, but to reorient tissue. So you've seen me inject Sculptra, and you know that. And I did this on Lupo Dermatology Instagram in April of 2020. I injected myself in my bathroom when I was shut down for COVID and I couldn't do anything. I posted injecting myself with Sculptra, and I called it the Sculptra 2-stick. And what I do is I go in along the jawline, that's stick 1, and then stick 2 is perpendicular to that. Because you want the jawline to have
an angle.
that definition there.
Right.
As we age, the jawline goes from looking like this to looking more like this, as you know. Mm-hmm. There's jaw regression. And so you start to sag first in that lateral corner in front of the earlobe. And it is extremely important that you reconstruct that area, because that area impacts the jaw.
Right.
And the other area that's often neglected is the temple. As the temple atrophies and sinks in, it drags down the lateral eyebrow and gives you that sad look. And because your eyebrow is drooping, you overcompensate and start activating that lateral frontalis muscle. But unfortunately, the lateral frontalis muscle doesn't go all the way to the tail of the brow. So when you have temple atrophy, you actually get that weird clown-like eyebrow shape from the lateral atrophy. And you've got to, and you know this because you put fat there all the time when you're doing a facelift. The lateral compartments are so much more important than the medial compartment.
100%.
Yet they often advertise more about the medial compartment.
And it makes people...
that's why there's so many people running around and they look like monkeys, and they're overinflated in this area here, because this is the focal when it needs to be lateral.
Wow. You know, Mary, you're just speaking like a plastic surgeon. I'm impressed. So what Mary is saying is that you're right. You know, we age centrally, laterally and centrally, but to really use less product, or go and inject always upper and outer to inner, in that OG. That's beautiful. And the temple area. Okay, so neuromodulators, the fillers, those are very important. Those are super. Okay, so what's your second of your trio that you say you tell patients they're coming in for their first consult and they're going, wow, I like it.
Injectables, devices, and skincare. So let's talk devices.
Right. Tell me about your devices.
So it depends on the age of the patient, but probably for the pre-rejuvenation, these are my big ones. I like to combine a low-level vascular laser for the deeper plexus of blood vessels, because when you heat them, you get deeper dermal collagen stimulation, plus you get rid of all the little broken capillaries that give your face sort of a ruddy appearance. And then layer on top of that, I love something called the 3D Miracle, and we do both of those lasers on the same day. The 3D Miracle is a low-level fractional ablative erbium. It's an erbium fiber laser, 2910 wavelength. And that yin and yang of the superficial and the deep, and I'll do 10 microns and 25% overlap.
Really?
And you have no downtime with that combination, absolutely none. And it is amazing what your skin looks like 2 to 3 weeks later. And I usually recommend a series of 3 of those.
So what are those lasers?
Other people, I do love my clear and brilliant laser.
Yeah.
Or I do a combo treatment of the IPL, which is a type of vascular laser, and milder radiofrequency microneedling, or I'll just do something called Laser Genesis, which, as you know, is one of my longtime pet lasers on the XLV platform, that is strictly 1064, totally painless, absolutely no downtime, and I'll recommend a series of 6. And that laser is very good for pores, for acne, as well as for rejuvenation. And it's all very good in, the 30 to 45-year-olds. Once you get over that, assuming you haven't been doing anything, I've got to do something more aggressive. But Rod, I do that layered IPL Miracle 3D on me at 69. I do clear and brilliant, which are light lasers on me, but I've been doing stuff for a long time. So these devices can be used in one of 3 ways. They can either be for younger patients as pre-rejuvenation. But they can also be used after a person does an aggressive laser. Like I did a Fraxel years and years and years ago. I don't need to do a Fraxel again. It takes such good care of my skin. So I boost it with a Clear and Brilliant.
Okay.
Or I boost it with the combo laser. Okay. And then the third group of people are the people who really need a more aggressive laser, but under no circumstance will give me downtime, in which case we still do the low-level lasers because something is better than nothing.
Right.
And I tell them they're just going to need a lot more than if I could do the more aggressive laser.
Okay. So in our time remaining, so we got the fillers and the neuromodulators, we've got the devices, and then we got the skincare. So wrap it up with your key, and I loved your recent Instagram about your skincare regimen. So tell me about your skincare that you would recommend to someone who's under 40.
Okay, so the main thing, I think the standbys, the absolute bare minimum is a really good sunscreen, SPF 40 or higher, and at night, either a retinol of some sort or some sort of a peptide, growth factor, or exosome product. That would be the bare minimum.
Those three things. Yep.
No. You can pick. In other words, if you're going to do just one thing in the morning and one thing at night, sunscreen in the morning and collagen stimulation at night. And you can do collagen stimulation with either a retinol or a peptide or an exosome growth factor product.
Okay.
But the optimal is to use an antioxidant and a sunscreen in the morning.
Right.
Antioxidant first, sunscreen on top. You know I love the C+ revision product if a person has a red face. If they've got a red face, I like the Illumier CE peptide, very stable form of ascorbic acid. But I don't like ascorbic acid for people who have redness in their face. Then at night, I'll have them use both a peptide and a retinol, or even better, a prescription retinoid like Altrino. Altrino is a retinoid that's mixed with glycerin, so it's much less dehydrating to the skin.
Wow.
And that is a bare bone, absolute, you will absolutely see results protocol.
Okay, that's awesome. Hey, I just came back from the Bahamas and, the sunscreen. Tell me about that. I mean, there's all these recent rage about, that sunscreens are causing cancer. So what's the truth behind all that? I know we've just got a few more minutes left, but tell us about the truth.
Sunscreens are very important, but as important as sunscreen is, make sure you're also on a vitamin D. Because sunscreens are really good at blocking UVB. UVB is the wavelength,
the burning
that makes you make vitamin D. You need vitamin D. Vitamin D. Listen, if you're low in vitamin D, your hair will start falling off. It will shed like crazy.
How much vitamin D? 5,000.
Lots of risks with low vitamin D. Yeah. So you want your vitamin D. I take 5,000 IUs of vitamin D every single day.
I do too.
So that's important. I tend to like physical sunscreens. Physical sunscreens are just what they would suggest. They physically block the light. Now, I have the advantage of being inherently very fair. And so I can use the zinc oxide and I don't need to worry about the cast or anything. I do also love the Neova. They have a chemical sunscreen with DNA repair enzymes. A very good thing to do, especially if you've ever had a history of skin cancers or precancers. And in addition to that, you want to take Heliocare Advanced, which is a combination of polypodium and niacinamide dose that has been proven in Australia to reduce skin cancer risk. So those are two very, very important things. Topical DNA repair product. You can get strong ones that you can use at night from Neova that have three ingredients in it that fight skin cancers. Or you can use just the daytime one, which has one. And there's one from Isden and there's one from Neova that I routinely recommend and use. Okay. Now, the chemical sunscreens.
I like the sprays. I like the sprays. I just don't like to paint stuff on me. I'm sorry.
You're such a guy. Okay, guys are terrible with sunscreen. The spray is better than nothing, but got to make sure you rub it in. And because if you just have it sprayed on and then you don't rub it in, you're not going to get the full benefit. It's going to just run right off.
So SPF 30 or higher, right?
I like 40 or higher.
40 or higher. Okay.
Yes.
Good. All right.
Yes.
Well, you heard it from the expert. Listen, I'm coming over. I need some better skincare. All right, Mary, as usual, you look beautiful and your advice is fantastic. As I mentioned, know before you go, you need a Mary Lupo in your life. So just make sure that you find a skincare expert or someone that really knows how to treat you and your family well, and somebody who's going to do things that make sense. Okay, so Mary, thank you so much. Make sure you leave us your comments and questions, and helping you become a better you. Mary, it was great. See you soon.
Thank you.
Yep. Bye-bye.